Hi, my name is Harpreet Bawa. I'm an orthopedic surgeon specializing in hip and knee replacement at the Thousand Oaks Surgical Hospital, which is an affiliate of the Los Robles Hospital Medical Center. I specialize in robotic-assisted hip and knee replacement surgery. One of the biggest advantages of performing robotic-assisted hip and knee replacement is the added level of precision and accuracy that we can deliver to the patients. Once I decide on the appropriate cuts for a specific patient, I bring the robotic arm in, and it allows me to fixate into a specific plane. Once I've been established into the appropriate plane, I then can proceed with making the appropriate cuts for that specific patient. Furthermore, the robot prevents me from deviating from a predefined boundary to ensure that I can preserve valuable soft tissues as well as structures surrounding the knee. Once I'm happy with the way that the cut has been positioned, the robotic arm then allows me to perform the appropriate resection. This translates into significantly less pain and a much faster recovery in the short term. And in the long term, it lowers the likelihood of requiring a potential revision or repeat operation.